exit, go to the main street, take a left on their main street, and then make a quick right, and follow this road.
Like, is it already at the height?
No, take that. Go that way.
Yeah, you gotta go. I'll walk you through.
Yeah, so you take the left to go. So you come through town. Yeah. It's like a 15-minute drive from the city of West through this back road. 10, 15 minutes. Yep, this one. Yeah. And it's nice out there. Is she making you bring your table off the floor? It's hard to get in from the other place.
Go. I'd like to call the Butte-Silver Council of Commissioners special meeting for Wednesday, July 27, 22 to order. Clerk, can you please get roll call?
10 present, 2 absent.
10 present, 2 absent. Please note that Commissioner Fisher and Commissioner Anderson are absent tonight. Commissioner Sawyers, can you lead us in the prayer and the pledge?
Thank you, Mr. Chief Executive. Fellow Commissioners, Almighty God, we implore you, look upon us and guide us this night as we make decisions which will greatly affect our community of Butte-Silver. Direct our thoughts, words, and deeds so that we please you and best serve our fellow citizens. Amen.
Amen.
Pledge
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next, we'll move on to any public comment on any item that is on tonight's special meeting agenda. If you would like to comment on that, please come forward, state your name and address. Seeing none, this call for the special meeting. J.P. Gallagher, Chief Executive, is calling for a special meeting of the Butte-Silver Council of Commissioners for Wednesday, July 27, 2022 at 7:30 p.m. preceding the Committee of the Whole meeting in the Council Chambers, Room 312, to authorize to sign the agreement between the Department of Military Affairs and an agency of the state of Montana and the city and county of Butte-Silver. So I would... I'll talk a little bit about our communication tonight. What this is about is, many of you guys were not on the board in 2017, but some of you were. When the Department of Military Affairs bought property out at Montana Connections. And with that, when they bought the property at Montana Connections, they talked to us about that Butte-Silver would have first option on their current military facility that's right out by Stodden Park. And so the one thing that benefits Butte-Silver is that we can only pay appraised value for the land. And so as they are moving forward and they've started construction on the new facility out at Montana Connections, they are now able to market this property, and Butte-Silver has an opportunity to purchase this property. Now, I want to give the background on this property. So this is essentially 3 buildings, 2 major office complex areas with lots of square footage. It is wired with all the updated IT. It has everything that you could possibly have because it's a military building. It has a lot of security. It's a bomb shelter. It has a yard. It has garage areas. And so this agreement is obligating Butte-Silver $20,000 on the buy-sell, and then our purchase would come in August of 2023 when the actual purchase would happen. Now, why do we need this? The Department of Reclamation currently is up in the Kelly warehouse. And if everybody knows, Head Frames is really, their business is expanding. They've been wanting to buy the Kelly warehouse from Butte-Silver. And so the Department of Reclamation, our weed department, and parts of our community enrichment stores things up in there, including Parks and Recreation. If we were to allow head frames to purchase this, we can use the money that is obtained from the purchase of the Kelly warehouse from head frames to go towards this purchase. What we could do right away, as is stated in the buy-sell, is the Department of Reclamation could move down there right away. They could take all of their stuff and occupy that. That would be our map and all of the operational materials that they need. All their equipment could go down. And so when I passed out to you the layout of the facility. So what you would have there is on the bottom portion of the facility, we'd have the garage area, the yard area on both sides. The two office buildings and the parking lot are not going to be accessible to us until after they vacate the property. Now, they're allowing us to be in there until till we exercise the purchase of the property. And then at that time, they may not be completed with their construction, and so we would authorize them to occupy those two buildings until their construction was finished as well. So that's kind of the agreement on this. Why is it necessary for us to do this now? The Department of Military Affairs is, by the obligation that we're committing that we would like to purchase this, they're able to go forth and help themselves in bonding for their projects that are going on as well. So it benefits us. There's a lot of future things that we could possibly do with this facility, especially the office buildings. Currently, the water billing department right now, we're struggling over in the water building with our heating, ventilation, IT. We could move down to this area and have an ADA accessible with lots of access to be able to run that operation down there as well. So those are things that we could do other departments, because office space has become a premium in here as we're now even still scrambling to see where we're going to put the new county attorney and staff for them as well. So this offers a lot of opportunities to do this. One of the other things that Commissioner Callahan asked us about with the take-home vehicles and stuff, some of the vehicles have been taken home because of the areas that we store the vehicles are being vandalized. They're cutting out the gas tanks and draining those things. It offers us a secure yard for people to park those vehicles at night, where we can lock that up down there as well. So those are the opportunities to do that. So with that, I'll open it up for any questions that commissioners may have. Commissioner Thatcher.
Thank you, Chief Executive Gallagher. If they let us move in, is there some type of leasing agreement, or is it just?
So this agreement, it would be, and we've worked with the county attorney. Is that what you're asking?
I guess how much money would we have to pay a rental?
No, we don't pay them any amount of money. The only thing that we have to do, which we've done out of our capital projects budget for the 20,000, we've already allocated that would be a purchase of that, or that's where that money would come out of. And so, I mean, we've got to do some things down there before we purchase as well. We'd want to go through full inspections, everything about the property down there. So we're really not obligated until August of 2023 to purchase this property, but we have this agreement in place that would allow us to occupy that maintenance garage and yards. Commissioner Mankins.
Thank you, Chief Executive Gallagher. So with the, you mentioned that the head frames is still in, looking to buy the Kelly mine after we vacate it.
Yes.
Is there a price tag on that?
We would have to get an appraised price on that, and so that's going to be one of those things that they're going to have to look at that property as it was prior to them occupying it. The improvements in it can't be really put into the price because they put a lot of improvements into it. So they're going to have to really look at the space and what the value of that space was and what they've done up there. But it does not include the head frame or anything like that. It would just be the buildings.
Okay.
Commissioner Reardon.
Thank you, Chief Executive Gallagher. I'm sorry, I was viewing the handout and all that. What did you say the price was?
It's $2.2 million.
$2.2 million? Okay,
Yep.
thank you. Sounds reasonable.
Any other questions of commissioners? And I'd just like to add that we couldn't build this for $2.2 million for what we're going to get. And the growth, the Department of Reclamation right now is a full-on department. It used to be that kind of piecemeal between departments, and it's a full-on department. And so they need to have a location to go, but we can put a lot of other things that will make departments more functional and are centrally located for us to get in and out of that location. So with that, I guess I'd go to Commissioner Shaw.
Thank you, Mr. Chief Executive. I also think this is a pretty neat idea. I do remember, though, when the consent decree was officially adopted, that I believe that the county is being reimbursed for a lot of different things. I know we're going to be having people working with ARCO and the other agencies that will be doing that, but I just was curious before I make my motion to make sure that there isn't something in that realm that would help us to do this sort of thing, since we are having to expand on our remediation agency.
Yeah, so just a quick answer to that question is that currently we're not charging Atlantic Richfield because Headphones is paying for that building up there towards that. But as we work with the budgets through Atlantic Richfield, that could be a part of their billing, that they would be paying rent. And so same thing with some of our enterprise funds. And so I truly believe that we can purchase this and have this done and the financing available for us without hitting the general budget at all.
All right. Thank you.
Commissioner O'Neill.
Thank you, Chief Executive. You mentioned the water, some of the water crew moving there. Was that?
So not really the water crew, the water billing. So as we walk across the street over here at the Butte Water Company building, it's not ADA accessible. People struggle getting in and out of there. We've had a lot of IT issues. We've had a lot of heating and ventilation problems over there. This place is set up completely, and you have if you look at the parking lot that was just done, Commissioner Callahan pointed out, was just done by H&H. That's probably, just the parking lot alone was probably a $500,000 job that was just completed down there as well, and that was done last year. Commissioner Sorge.
Thank you, Chief Executive Gallagher. JP, what's that zone for right now currently?
So it's currently zoned residential, but because it's already primary, it's being used as this and has been, I've talked to Dylan Pipinich about that. We would be able to be in the same, I think, type of variance. I'd have to ask Dylan exactly how that works in there, but it's in a zoned residential. Part of it's in the zoned residential and part of it's in the zoned light industrial. But he said that it wouldn't be an issue because of the use that is already currently being used for.
Okay. Thank you.
All right. Okay, I can do it now.
All right.
Thank you, Mr. Chief Executive. At this time, I would move to concur with the Communication 2022-379 and places on file to authorize to have the Chief Executive sign an agreement between the Department of Military Affairs and Butte-Silver.
Second.
We have a motion and a second. Is there anything else on the question? Could commissioners please vote? Commissioner Shaw. Looks like. Doesn't want to do it.
There we go.
Oh, there we go. And would anyone like to change their vote? Clerk, please record the vote.
10 yea, 0 nay.
10 yea, 0 nay, motion passes. And with that, I will take a motion to adjourn.
I move to adjourn.
We have a motion and a second. All in favor, signify by aye. Aye. Opposed? This meeting is adjourned.
Clerk, are you ready? You want to check in? Much better. Okay. Well, welcome now to the Butte-Silver Borough Council of Commissioners Committee of the Whole meeting, Wednesday, July 27th. Welcome, everyone. And could we have roll call, please?
9 present, 2 absent, 1 presiding.
Thank you. Let the record show that Bill Anderson and Commissioner Fisher are absent. We already had the prayer and pledge. At this time, I would ask for any public comment on any items on tonight's agenda. And just make a quick perusal here. I see none. Report of the chair. Don't really have anything to report at the moment, so we'll just get on into our sections here. Starting with Section 1, Communications, we have Item 1, Communication Number 2022-296, Danette Gleason, Finance and Budget Director, notifying the Council of Commissioners that the fiscal year 2023 preliminary budget will be referred to the Finance and Budget Committee for the July 6, 22 Finance and Budget Committee meeting, which will be scheduled to start at 5:30 p.m. in the council chambers. This communication is a placeholder as we go through our budget cycle. And I'm going to call on our Finance and Budget Director, Commissioner Sorich.
Thank you, Ms. Shaw. As everybody, fellow commissioners, as everybody knows, this is the communication last week that I segregated out so we could keep it in front of us, so if anybody has any questions or comments or whatever, so we can still, because it's still actually the commissioner's budget until the, it's the public hearing until it's adopted. So we can actually talk to it, and then I'm also going to ask Karen Hassler to come forward and give us an update on the status of the 2023 budget and see how we're coming. So
Ms. Hassler, welcome.
Good evening, Madam Chair, members of council, Councilman Sorich. My name is Karen Hassler. Last week, Ms. Gleason gave the budget presentation, and knowing that those numbers are very fluid at this time, so we're still reconciling some of our projects and our grant funding. So what that means is we're taking all of the expenses from fiscal year 22 and reducing those amounts that are going to go into the fiscal year 23 budget. Ms. Gleason is also anticipating the receipt of the certified values from the Department of Revenue early next week, so that she can complete her resource and requirement budget, or resource and requirement schedule. And what that does is gives her the certified values and determines the number of mills that will need to be levied in order to balance the budget. So next week, she will also conduct the public hearing. It will open, and there will be amendments to the budget to reflect the changes that we are in the process of making for the grants and for projects. And we've also received some new grants too, so you'll see some additional funding that will come through. And then the public will have the opportunity to comment on the budget, and there will be much discussion, I'm sure, based on what you have already received. So after that, the public hearing will remain open, and her hope is that upon receipt of those certified values early next week, that the budget will be adopted on August 10th, but it's all dependent on the receipt of the certified values.
Thank you,
Commissioner
Karen.
Sorich, anything else?
I don't know. I would, I don't know if any of the commissioners have any other discussion or anything they want to, discuss or bring up. If not, I would just like to hold this communication number 2022-296 until after the public hearing.
Thank you. Any other questions for Ms. Hassler? Otherwise, we will continue to hold this placeholder during our budget cycle. So, thank you, Karen. All right. Okay, moving on to item 2 is communication number 2022-342. Danette Gleason, Finance and Budget Director, requesting Council Commissioners authorization for a presentation on July 20th, 2022 for the presentation on the fiscal year 23 budget. We did have that presentation last week, so Commissioner Frederickson.
Thank you, Madam Chair. I move to place communication number 2022-342 on file.
You hear a second? Thank you. We have a motion and a second to place communication 2022-342 on file. Is there anything on the question? Would everyone care to vote, please? And would anyone care to change their vote? The clerk, please record the vote.
10 yea, 0 nay.
10 yea, 0 nay, motion passes. Item 3 is communication number 2022-354. Eileen Joyce, Butte-Silver County Attorney, requesting Council Commissioners to complete the state-approved SUD treatment and prevention form for submission back to the DPHHS Addictive and Mental Disorders Division. And as you know, this is our second round that we're going to be listening to some presentations of agencies that have been approved, their service providers that are approved by the state, and we ask that everybody give us an opportunity to hear their presentations. So we have 3 this evening. We will start with Butte Cares. Tammy Martin is going to give us a short presentation on her organization. Tammy?
Thank you, Madam. Can't hear me. Thank you, Madam Chair and members of Council, Chief Executive. So my name is Tammy Martin, and I am the Program Administrator for Butte Cares. Some of you know Butte Cares very intimately, and some of you may not, so I just want to give you a real quick idea of who we are. We do prevention efforts for drug and alcohol and for youth. We care, our community cares a lot about our youth, and so we want to give them every opportunity. Butte Cares began in the early 80s by a group of volunteers who were teachers who saw the effects on their students in school as well as out once they've graduated from high school. And so they came together as a coalition to do something. In the 90s, they became a 501c3, and today we now have 3 grants that we primarily work out of. We have expanded where we are now Southwest Montana Prevention and are in 12 counties. And so today I'm here really, though, to talk about what we are doing in Butte-Silver County, because that's what the funding is for. And so I do have some slides that I want to kind of go through. I'm not really going to talk much about them as I go through it, but I am going to show you and talk about some other things. A lot of the things that we have done have been alternative activities. That is one of 6 different ways that science has proven that we can reach youth and make a difference. Those 6 strategies include community-based process, which includes our coalition, the efforts that we do in that coalition, our health fairs, and our partnerships. Our coalition also, we have an adult coalition that meets every month, and we also have a youth coalition. Right now we're recruiting some new ones to get started, and we'll begin that in September for them meeting regularly. Dissemination of information is another one. Some of you may have seen our YC magazine that goes out. Primarily we send those home with students during the school year, and then in the summer they get mailed for practical reasons. We also do have some that get mailed out throughout the year as well, but that goes 4 times a year. We also get information out through billboards and radio ads. You might have heard some of them on the radio. We also do prevention education. All of the prevention education that we promote is evidence-based, meaning that there's been a lot of research and science behind it to show that it's effective, so that the dollars that are spent on it have a return. And some of the programs have up to $20 of a return on that. So for every dollar of prevention that's invested, we are basically saving $20 per dollar in the long run with those kids. I'm going to stop the slide right there. We also help to implement policies and procedures that are evidence-based. We do environmental strategies. Some of those environmental strategies are alcohol server seller training, and we work with the Department of Revenue to be able to provide that for free to our community. And then we also do a referral, information and referral, which includes our the promotion of Connect online referral system, peer support programs, and things like that. And then, of course, as you saw, all of the different types of alternative activities. As I went through that, you also were able to see some of the partnerships that we work with. So we have local government representatives that work with us that are very active in our coalition. We work with the DUI task force, other parts of law enforcement. The health department has been very active with us over the years, especially the tobacco prevention specialists. And you saw in the clothing drive, Harrington Pepsi and Cherry Creek Media. Also, Butte Broadcasting is one of our partners, YMCA, Silver Bow Schools, Town Pump, Thrifty. They're very now I can't even talk. They have for years partnered with us on the Sticker Shock program. So if you've been in to buy alcohol from one of their beer coolers, you'll see a sign that says "Stop, selling to 21 is illegal," or something of that nature. And so they have worked with us for many years to be able to put that up. We did the bike lab and have the Bike Lab and the Kiwanis partnered with us for doing the bike rodeo, which was part of something that the Kiwanis has been doing for a long time, but our bike drive has been in addition to that. We also do work with the Rotary Club, and we have a lot of churches that we do things with. And so all of that are just ways to be able to reach the youth. That increases protective factors for the youth, that helps them just to have a good opportunity, and it puts those dollars to good work. Some of the things that we've been doing with the schools is we have a program called Media Detective, and it targets kids from third grade through fifth grade, and we've been showing it to the fourth graders. And what it does is it helps to educate the youth at their level of education for them, so nothing that would be over their head or introducing them to things that they're not already aware of. But it helps them to see how advertising and media targets them with drugs, alcohol, and tobacco. And it makes them aware so that when they see, then they can have opportunities to make choices that are good choices for them. And then for years we've been doing what's called Healthy Citizens, or it's what we call Healthy Citizens, but it's some drug and alcohol prevention that we do with fifth graders. And so those are just some of the programs that we do. Every 2 years, we have what is called the Montana Needs Prevention Assessment that is conducted in the school. The last one that was conducted was in 2020, just before COVID shut everything down. But at that time, we were able to see what the students were reporting. It shows us the trends, and we've been doing this for many years. We've been able to see trends, whether they've gone up or down, and some of the concerning trends are the increase of how much youth are drinking, between 1 and 2 drinks and 6 and 9. Both of those went up for within the 30-day use. They increased from 1 to 2 drinks. The number of students who were drinking 1 to 2 drinks increased from 12.6% to 17% of our 8th graders. And those who were drinking between 6 and 9 drinks in that same time frame went from 2.8 to 4.5. We have lots of research that has been done nationwide that has shown that during COVID times, alcohol use went up. And we just had the Montana P&A was done earlier this year. We'll get those results in September. And unfortunately, we're expecting to see those numbers go up even more. There are other things that affect underage drinking, and some of that has to do with drug use. When drug use is seen as favorable, alcohol use also goes up. And so we expect to see some of that with the passing of state legislature that has happened. So we have a lot of things that are good too, though. Overall, from 8th grade through 12th grade, the 30-day use trend has gone down from overall. 8th grade is a real concern, though. Most kids are reporting that their first drink is when they're 13 years old. So anyhow, we have a lot of work to do. We've been doing a lot of work. It's been really good work, but we have much more ahead of us to go, and we know that the things that we do work and are effective. So that's a little bit about who we are and why we need those funds, and how those funds would just continue to increase the efforts that we are doing, and to even pay for things that are outlined by the state of what that can cover, but also it covers some things that our grants don't cover. So it will enhance what we're able to do.
Thank you, Tammy.
Yeah.
Any questions from council members for Ms. Martin? Commissioner Mankins?
Thank you, Madam Chair. I just want to thank you for coming here and telling us a little bit about what you're doing and how you're trying to help the youth, and partnering with different entities within our community, and the positive things that you are doing for our youth. So I want to really appreciate your time and effort by saying and what you do for our community and our kids. Thank you.
Yeah, thank you.
Any other comments? Or okay. Thank you, Tammy, for coming. I'm very much aware of Butte Cares, and you folks do a lot of things, and it's mostly with kids, and I really appreciate you and your team. So.
Thank you. We love doing what we do here too, and appreciate your support.
Okay,
thank you.
Okay, our next presenters are the Community Health, Southwest Montana Community Health Center, Jamie Vanderlinden. Hello, Jamie.
All right, thank you for having me. My name is Jamie Vanderlinden. I'm a licensed clinical social worker and licensed addiction counselor at the Community Health Center here in Butte. I'm also the director of behavioral health. So we are a federally qualified health center, so it's impossible for me to talk about our substance use services without also talking about what we do for the whole person. We are completely integrated. So what that means is our patients have a primary care provider who is providing for their medical services, as well as the option to have behavioral health for their mental health, their substance use. We also have care managers who will assess for social needs, resources, and then connect them to those services, and dental. So these are all services that a person living with a substance use disorder or a mental health problem could be experiencing. Oops. Okay, and generally we serve about 14,000 patients a year between our 3 sites. We're here in Butte and also Anaconda and Dillon. We have 6 therapists in Butte. 3 of us are dually licensed as addiction counselors, so that means that we can provide both of those services. From a prevention standpoint, we try really hard to normalize that depression and anxiety happen to us all. Substance use is possible for anyone, so all of our patients are screened at least annually for depression, anxiety, substance use, and alcohol. So the goal is that we're making this a normal thing that we talk about with our medical providers, because that takes away the stigma from those issues. With our teens, we screen every time. Every teen, every time, because teenagers change so fast. You saw them one day, they're not using, the next day they are. You just don't know. So SBIRT is the model we use, and that means screening, which is that screener we do with every patient, and then a brief intervention. That brief intervention could be prevention. It could be, great job, good for you not using. Or it could be a referral to services. And like I said, we have 6 therapists in our building, and the primary care provider can literally push a button that'll send a page to us, and we will show up at that exam room to work with that patient right that second. And then from there, we make that decision of, is a referral necessary, or is this something we can treat here in-house? Our goals are, we want to improve the overall health of an individual. If someone has an alcohol use disorder, they are likely struggling with other medical issues, whether that's diabetes or heart disease, problems with liver functioning, there could be something else going on. We want to reduce hospitalizations. We know that the ER sees a lot of our patients, and our goal is if we can help prevent that and give them a medical home where they can come to, that's going to reduce the cost overall for Medicaid and the hospital. And as I said, reducing that cost of medical care. So we're going to improve the overall health of a person and hopefully just improve their lives in general, enhance their motivation so that they really can live a full life. So we do this a few different ways. Our adult therapists provide integrated care using brief therapies. So that term is a little deceptive because sometimes people get it in their heads like, oh, that means I have 8 times to see you. And that is not true. We actually see patients for their entire lives if they would like to. What it means is that I'm not tied necessarily to, I have this patient, I'm making a treatment plan, I'm going to see him for a year, I'm going to see him for 6 months. It's week to week, we're going to assess how you're doing, and do you need to come back? Because my hope is that I'm doing my job and you feel better, and maybe you don't need to come back next week. We also provide medication for opioid use disorder. So we have providers that have their waiver to provide Suboxone to patients. We have an agreement with the hospital that they will start a patient on the Suboxone, and that patient can walk into our clinic anytime. We're open 7 days a week within those working hours, and we will continue their medication. And for those patients, we also provide individual counseling and group counseling and care management. So the care manager meets with those patients, assesses their needs, and connects them to resources. And we do phone call follow-ups with those patients as well. So we get some wraparound care there. We also have a grant to do what's called Contingency Management. And what that is for is a meth use disorder. So with meth, when a person uses it, it fires that dopamine in their brain that tells them they're happy, and then they stop using and they don't feel happy anymore. So we're trying to change those pathways in the brain to tell them they're happy by patients come in and they run a urinalysis for us, and if that is negative for substances, they get a gift card. So we're trying to change that pathway in the brain that they get a reward when they're not using. Those patients also get group, and they also get individual counseling. We also have a psychiatrist on staff. He does consultation and also sees patients. So say a patient is seeing a medical provider and they've really been working hard trying to get you on the right medication, but it's just not working. They have the option to go talk to a psychiatrist. These are the symptoms I'm seeing. Does it sound right to you? This is the med I've tried. Does that sound right to you? And he can give a recommendation. If that recommendation doesn't work, he can see the patient in person and give medications from there. We also provide therapies for children. So we offer parent-child interactive therapy, which has an evidence base to reduce child abuse and improve relationships with kids. It's literally a parent being coached by a therapist in their interactions with their kids and learning to discipline in a positive way. We also offer trauma-focused cognitive behavioral therapies for our kids. We have parenting classes using Circle of Security and co-parenting classes as well to try to improve those relationships. We have the care managers, like I said, that work with the patient to assess needs. One of our care managers actually tried to engage patients in going for a walk even, because we know that going for a walk is actually better for you than using antidepressants even. There's some research that says going for a walk 30 minutes a day shows more improvements than Zoloft. So, those are just some of our services. We serve all people. Anyone that wants to come to our clinic is welcome. It doesn't matter if you have insurance or not. It doesn't matter if you have Medicaid or not. Anyone can come. If you don't have insurance, we can help you get connected to insurance. Our care managers are trained to help people with Medicaid, with Medicare, and the Affordable Care Act. We also have a program called the Healthcare for the Homeless program, where we can help people with no insurance who are living in homelessness. And that gives them free access to medical care at our clinic and behavioral health care and one dental appointment and an eye voucher. From there, we work really hard to get them on Medicaid because we know people have more issues than we can serve at our clinic, and we want them to have access to that too. We treat anyone, situational stressors, depression, anxiety, substance use, trauma. We treat everything. So far this year alone, we've served 189 patients with a confirmed use disorder. So patients aren't always honest with us, we know that, but so far we have 109 confirmed use disorder patients. 48 of those patients had an alcohol use disorder, In 2021, we served 150 patients with a confirmed use disorder, 56 had an alcohol use disorder, and in 2020, we served 115 with a confirmed use disorder, and 45 had an alcohol use disorder. So you can see our numbers just going up. Like I said, we have a couple of specialty programs as well, that integrated psychiatrist that's able to serve our patients, and then our programs for opioid and methamphetamine use disorder. So just a couple quick facts for you guys. And these are old numbers. This is from 2016. Studies show that collaborative care model that we have actually has better outcomes for patients with depression and anxiety and medical disorders. And that for every dollar spent on our model, we save $6.50 in healthcare in general, which, like I said, that's an old number. And that only 50% of people get to specialty mental health or treatment. So that means that someone comes in to see us, we do a referral, there's a really good chance they're not going to get there for whatever reason, whether that's a loss of motivation when they leave our office, whether that's a wait list at the center, whatever it may be, 50% of patients don't actually make it to that referral. Whereas, like I said, we have that button, the primary care pushes it, therapist shows right up. And we know that improves our odds of the patient coming back. It's not perfect, but it definitely improves the odds when people have a face and they know who we are. Most people come to their primary care when they don't feel good, right? You don't feel good, you come to primary care. Anxiety often lives in our bodies, so we feel like this, and people often think they're having a heart attack. They go to their doctor. The doctor says, oh, push the button, you need to talk to Jamie. So that is really common. And this is actually, I saw updated information today that actually 80% of antidepressants are prescribed in primary care. So we know we're seeing these patients. And that often a substance use is a secondary diagnosis, right? There's underlying trauma, there's underlying anxiety and depression, and that's why a person is using. I don't feel good. I want this to go away. And drinking makes it go away. Using makes it go away, even if I only feel good for a minute. Okay, so that is the Southwest Montana Community Health Center. Does anybody have questions for me?
Thank you, Jamie. Any questions from council members for Jamie? No, great presentation. We really appreciate you coming tonight.
All right, thank you.
Okay. Okay. And our last presenter is at Alpenglow here in Butte, and I'm going to call on the director of Alpenglow here is Chad Kingery. And he has other people in his group that he certainly may refer to and have come.
Picked the wrong day to wear a wool suit. It's a hot one. I do have some pamphlets and some information that I brought with me. Yeah, first and foremost, thank you very much for inviting us. I was floored when we got the email. Alpenglow Clinic is a state-certified chemical dependency and mental health clinic. We are a for-profit organization with 4 clinics in the state. We have a clinic in Bozeman, here in Butte, Kalispell, and Columbia Falls, and we just opened up a clinic in Eureka. The opportunity that this is presenting, again, I can't thank you guys enough. The challenges that Alpenglow Clinic has been experiencing is that we are primarily a Medicaid reimbursed program. I want to give you guys an addendum to the slides that we originally gave you. The numbers were off, and so I want to clarify the amount of clients that we've seen currently just in the Butte population. So we've been open for not quite 24 months here, and we have served 1,346 total clients, 1,346. Of those clients, 814 of those clients signed up for treatment. 67% of those have completed our treatment and graduated, and we've done 532 DUI ACT and Prime for Life program clients. Let me grab the, how do I run this thing here? Yeah. Hey, when I tell you this is new, this is new. So let me just, I guess, kind of tell you the history of what has gone down in some of the other counties that we're licensed in. the system has been set up to, it's been a very functional system, right? But since the for-profit organizations have been allotted to carry the state certifications for licensure of the stuff that we do, it's been very difficult to kind of access some of the funding that is available to us, all right? So Alpenglow Clinic has survived over the last 5 years since our inception, and the last 2 years here by just working hard, 100-hour weeks sometimes, and just doing what we do best, which is provide a trauma-informed, family-type atmosphere, and we have a lot of fun with our treatment. We've seen a tremendous amount of success with the open arms approach that we carry with our clients. By kind of thinking outside the box. I mean, we have very evidence-based practices. We are a co-occurring treatment facility that runs up to 9 hours in an intensive outpatient program. So a lot of the facilities that are here that are treating substance abuse have a specific angle that they take. Our state license affords us to offer up to 9 hours of service for a client that's in an intensive outpatient program. So they have, anywhere from 2 to 3 3-hour groups in individual session, and they're in the clinics up to 4 times a week. So our state license, and being that we're a for-profit organization, a lot of the challenges of limitations with what we can do by thinking outside the box have been eliminated. Some of the things that we do for our clients is rent movie theaters and have family night, invite the entire family into the clinic. We sponsor treats. We kind of break up the monotony of the trudgery of, you're an addict and you're going to, work on understanding the size of the problem, and, let's talk about consequences of your use, that kind of stuff, right? Those things are important, but it's equally as important to parallel that our clients are human and that they have a disease, right? So some of the stuff that, we would like to focus on, if awarded some of the alcohol tax dollars, is a prevention type program that is going to help educate the current system. And let me kind of give you an example, okay? Most people don't understand that addiction has nothing to do with the drug of choice. It's all dopamine levels, okay? Drugs and alcohol have one thing in common. They release massive amounts of dopamine into the midbrain, which is the part of the survival mechanism that keeps you alive and puts you in these modes where, you're going to do whatever it takes to get the drug, right? So once the brain's elevated dopamine levels get to a place where the brain has reset its hedonic set point, it now thinks it needs that much dopamine in order to survive. And that's what creates the powerlessness and the unmanageability that we see with the disease, okay? So the angle that we take in trying to treat that is just as informative with the psychoeducation that we do, but we'd like to expand that. And what I mean by that is, up in our Kalispell clinic, we've got a very proven peer support program up there that is not contracted with probation and parole, but we have an operating agreement with them where they send us some of their more severe mentally challenged clients that have the more severe addictions. And our peer support person has a company vehicle up there and can focus up to 9 hours specifically just with that client in order to get them to their appointments, help them with case management stuff, housing opportunities and all that, right? But what the peer support person can do down here is also parallel what we're doing up in Kalispell with prevention by educating the stakeholders and the people that send us clients, okay? We are working very hard to try to save the federal government money by doing the approach that we have with education. Medicaid it's very limited with their reimbursement, okay? But the recidivism rate that we see across the country with clients, I believe, has a lot to do with the lack of understanding of the disease model. And so the prevention aspect of it would be to educate people that you can't support marijuana use if somebody stops doing opiates, because marijuana doubles the dopamine levels in the brain, and people, have this understanding that it's an okay substance to use because it's legal, right? And that gets into the minds of our clients, and we're finding that we're because of the lack of education, we're finding a lot of challenges with getting, say, probation and parole, child protective services, some of the entities and stakeholders that send us clients to support the fact that, hey, I'm spending the government's money to teach people to fix the problem with the problem that created the problem. That's insanity, in my opinion, right? So we're very limited with the amount of materials. We need We need a company vehicle down here. We need to hire a peer support person that can help us do that prevention type stuff with the stakeholders. And more importantly, some of these funds would be used to secure a clinical director position down here. I brought, some of our amazing staff. We've got Stephanie. Yeah, I'm like, yeah, I live in Kalispell, right? Okay. Yeah. Dr. Dix, she's our administrator. Lisa Pasante is going to be coming on board to be a clinical director, and then one of our LACs is here. The other things that we're pioneering that we can use some of the alcohol tax dollars is this. The system is very broken when it comes to raising the level of care of somebody that is not progressing in outpatient, okay? In the past, the way things have happened is you do a continued stay review on the client, you do an evaluation on them. Yes, they meet criteria to now go to inpatient, right? How many people can tell me what the average turnaround is or how long it takes for me to send an evaluation to the inpatient facility before the average person gets a bed date? What do you think the average turnaround time is? Yeah, MCDC's averaging 6 to 10 weeks, depending on whether or not you're male or female. Rimrock, if they've already been kicked out of MCDC, Rimrock has 4 Medicaid bed dates a year. It's 4 to 6 months before they can offer a bed date, and that's kind of a transcending problem, not just in our state, but with most states, right? So we're a very solution-focused clinic, right? And so what we've done is we've established an operating agreement. Let's call it a brotherhood, a partnership. I've brought Bob, who is the administrator of Recovery Centers of Montana. They're a 50-bed inpatient facility for men and currently have a 35-bed licensed Medicaid facility for females. And we have pioneered a program that literally can put people into their treatment, inpatient treatment, within a matter of 2 days. I've even brought people straight to treatment in 1 day. And that's a relationship that I would really try to want to foster, because when there's delays, well, the addiction runs riot and clients go out and get other felonies. The midbrain says, hey, you're going to treatment, and they derail, they use more drugs, more co-occurring. It's just been this revolving cycle that's been very frustrating to try to manage, right? So alcohol tax dollars, yes. Prevention, we would like to use some of that money to offer health insurance. For 4.5 years, we've got 20 employees that have been working without health insurance. There's not enough profit margins when you're working with strictly Medicaid. We would like to use some of those tax dollars to offer, health insurance and paid time off and stuff like that to the current employees. A vehicle for peer support, and of course that prevention program, and then some of the transportation costs and some of the costs that is accrued with the way we're getting people into inpatient from our facility. Sorry, I kind of just unloaded on you there. There's normally 3 and there's 12 of you. Okay, so I'm like, right? Do you have any questions? Like I said, we're kind of new to Butte. I think the bullet points of what I would like to, impress upon the commissioners is that we are a state licensed chemical dependency clinic, okay? So we do up to 9 hours of outpatient treatment all the way down to level 0.5 education. And I forgot to mention adolescents, right? There's not a whole lot of people, a lot of availability for services for adolescents in Butte, and our staff is currently seeing quite a few adolescents. We're working with Judge Pesdark. We kind of have this system going where we operate month to month, back and forth between the facilities that are state licensed here, and we do a lot of prevention and education, and we do the tobacco cessation courses down here as well. Yeah, so we'd like to expand the adolescent stuff, Unfortunately, Butte is not the only, Silver Bow County is not the only county that's kind of experiencing that tragedy. I think statewide, the adolescent programs are fizzling out, and it's a tragedy because most of the adolescents are just going straight to Pine Hills because they don't have any place to go, right? So yeah, you kind of have to have a certain type of mindset to work with adolescents, right? And those people are available, and we'd like to hire them and expand our services to include the 9 hours of outpatient services with adolescents as well.
All right. Thank you, Mr. Kingery, and your staff. Thank you all for coming tonight.
Right.
Are there any questions from any staff, council members the staff? All right, well, thanks again, and we really appreciate your being here. I remember when I first came by, you had your open house 2 years ago. It's been 2 years, it's hard to believe.
Yeah, it's gone by fairly quickly, huh?
Appreciate your being here.
Yeah,
So-
well, we're blessed to be in Silver Bowl, and, yeah, we thank you for the opportunity.
All right, thanks again. So at this time, we had five of the seven agencies that were qualified for the tax, the alcohol tax monies, and 2 did not respond. So the 5 that we have already heard from, including the 3 tonight, and of course the SMART program and Youth Dynamics, that's the 5. I was just thinking that we might, this still is on our agenda. It'll be in our community of the whole report next week. And I don't know if you'd like to take a week or so, a week to digest what you've heard, and we'll come together again. Of course, what we decide will be on the record, on the floor. We'll bring it up again next week. If that sounds like a good idea, we can hold this in advance until next week. Any questions, Commissioner Reardon?
Thank you, Chairman Shaw. I guess I kind of lost track here. What amount of money are we dealing with here?
Well, I wish I could tell you. I asked Annette, I asked Eileen today, because it wasn't in our, on this original instruction for doing this designation form, but I will find out. I don't think it's any more than 70,000, something like that.
What was that again?
I'm sorry?
It's not more than what? I mean, I'm not holding you to it. I really think that would be, if we're not sure, would be very influential on making some of these decisions, you know,
Yeah.
about what to do with this money and be fair with it, you know? Huh?
Chief Executive Gallagher.
Thanks, Chairman Shaw. Commissioner Reardon, we'll get those numbers for you so that you guys will have an accurate accounting for what you have to distribute.
I think judging from the past, it's right around that 70,000. Okay, so with that, we'll just hold this in advance. Everybody's on that, okay? And everyone got the piece of paper, just a reminder. What I'll do is once we make our decision, which we are called to do that by the state, I'll have Barb type it up in, the chief executive and I will both sign the documents at that time and submit it, okay? All right, very good. Okay, where am I? Here we go. Item 4 is communication number 2022-365. Jeff Riggs, Thornton Group member, requesting council commissioners authorization to purchase the parking lot property owned by the city, county on West Court Street for the listed DOR value of $41,306. We understand a small part of this parking lot is on property owned by Western Montana Mental Health, and that the sale would be contingent upon a separate agreement with them. I believe this has been referred to land sales, and I am awaiting their response back to this body. Item 5 is communication number 2022-366. Danette Gleason, Finance and Budget Director, requesting Council Commissioners' concurrence to schedule a public hearing for the adoption of the fiscal year 2023 final budget and establish the user rates for Metro Sewer, Stormwater Sewer System, Solid Waste Disposal and Collection, and Road Maintenance District. The public hearing will begin on August 3rd and will be continued until the Council Commissioners set a date to adopt the fiscal year 23 budget and fix the rates and levies. We will hold that in advance until August 3rd. And item 6 is communication number 2022-375. Karen Burns, Community Development, requesting Council Commissioners' concurrence to schedule an RFP opening on August 3rd, 2022, related to the Finland Hotel Fire Suppression Project funded by Cdbg ED grant awarded by Butte-Silver. And we will hold that until August 3rd for that RFP opening. So we've reached the end of our meeting, other than any public comment on any item not on tonight's agenda. And I don't see anybody out there jumping up to say anything. So anything else to come before us this evening? If not, I would entertain a motion to adjourn.
Motion to adjourn.
We have a motion and a second to adjourn. All those in favor? Aye. Opposed? Motion carries. Thank you, everyone.